That I'll now introduce my good friend Troy to come up here and add a little bit more.
Thank you.
God bless.
Well, thank you, Congressman Roy, for those words, and thank you all for being here, and thank you for having me. It's an interesting problem. I agree with Congressman Roy there that this is a big problem. And one of the issues that we have that we're constantly dealing with is I have colleagues that are not willing to admit that the emperor has no clothes. The ACA has been now 16 years of adverse selection. So as it gets more expensive, young, healthy people seek alternatives. Concentrates the risk. Concentrate the risk, the prices go up. Prices go up, it gets more expensive, you have more adverse selection. In my personal opinion, this is going to collapse under its own weight if we don't do some meaningful reform. And some of the things that have really concerned me is I watch this. I came from a family of fairly modest means. My mom worked in a grocery store. And as a kid, she'd take me to the doctor, and as we walked out, she'd go up to the front desk and she'd get out her checkbook and she'd write a check. We didn't have insurance, but that private practice was priced for that community. And my mom, as a grocery store clerk, could afford to pay those costs. That's completely gone. We're making it harder and harder for people to for providers to be in private practice. We need to reestablish that patient-provider relationship. And so many of the things that we've seen, even like price transparency in hospitals, the problem is most consumers don't care because somebody else is paying the bill. What happens if you expand health savings accounts, if you have HSAs so that they're not tied to a high deductible employer plan, that you can actually have tax effective money there to make your own decisions, and that those are finite dollars, you're going to start asking. You're going to start asking about those prices. You're going to start asking about those services. If you go to a doctor and they say, we've done a test and it's 95% sure that you have this, but for another $20,000 test, we're going to be 100% sure. If somebody else is paying it, you're going to go, heck yeah, I want that other test. If you're paying it yourself, I'm pretty sure that, the first diagnosis was right. You're going to move on and you're going to start dealing with those prices. We need to get back to that point where private practice can thrive, where you can reestablish that patient doctor-provider relationship and start thinking about those things. Get consumers, put them in control of their own healthcare costs and their own decisions. I think that there's an incredible amount of meat on the bone. There's other things out there that I want to talk about. Any of you, go talk to your hospitals, your providers in your state, and ask them about Medicare Advantage. The problem is I'm a former regulator, and CMS, the Center for Medicare and Medicaid Services, was always kind of a black hole for me. And they had ideas about network adequacy in Montana that didn't work, and whenever I had Joe Namath or Jimmy Walker selling MA plans in Montana with either inadequate or zero network, there was nothing I could do because I did not have the authority to do that. So another thing that I'm hoping to get into reconciliation, because I think this would be a huge savings on fraud, is give states the ability to enter into collaborative enforcement agreements with their state regulators. Because the state regulators, they care about the people in their state, and they're going to pursue that, and they're going to start fighting that fraud. There are so many things that we need to do to fight this fraud, to give the people what they want, give them access to health care, reestablish that patient-provider network, and really take this on. Because as I started this out, after 16 years of adverse selection, this is going to collapse under its own weight. We need to do something. We need to do something now, and we need to convince those folks that are in opposition that the emperor really is not wearing any clothes right now, and we need to do something about it. On that, I want to thank you all for giving me some time. Thank you. And I'm going to introduce an esteemed freshman colleague of mine, Congressman Barrett.